Now, regarding the next bacteria, which is Haemophilus influenza. Never confuse with influenza virus and Haemophilus influenza because influenza virus is another category of negative single-stranded RNA orthomyxoviruses. But the Haemophilus influenza, it's a gram-negative bacteria. Influenza virus can influenza when a patient is under attack of influenza virus, it can cause secondary bacterial infection, and in this infection we have all the shine bacterias. But influenza and Haemophilus influenza are the two different entities. So Haemophilus influenza, as we know that it's a small gram negative Coccobacilli, and also it is a IgA protease producing bacteria. It means it can evade immune response. It is encapsulated, and its capsule is formed by its capsule is formed by PRP, which is also known as polyribosylribitol phosphate, PRP. PRP. And this PRP capsule is very much antiphagocytic. It evades bacteria from the immune response. This capsule is commonly conjugated with the diphtheria toxoid and also outer membrane protein of Neisseria meningitis to form a vaccine which is known as vaccine HIB, and this HIB is vaccinated throughout all the children from the age of 2 to 18 months. And this vaccination is a conjugate type of vaccination, and this helps the patients to gain cellular and humoral immune response against the Haemophilus influenza, against shine bacteria, all those. So a small vaccine, and it has a lot of different functions. So in vaccinated or immunized patient, the most common cause of infection from Haemophilus influenza is by its encapsulated or naked non-typable Haemophilus influenza strain, and it can cause mucosal infection, which we'll describe in a short while. But in the unvaccinated or unimmunized children, the most common diseases presented by influenza virus is the HIB, or the encapsulated Haemophilus influenza. It causes meningitis and also septic arthritis as an invasive disease. So the vaccinated patients, the mucosal infection, what are the mucosal infection? There is a mnemonic E, the Haemophilus influenza, and in the Haemophilus we have the EMOP. So first one is epiglottitis. Epiglottitis is the inflammation of the epiglottis, in which there is a swollen cherry red colored epiglottis, and this epiglottis is very much it makes dysphagic patient to be dysphagic, no swelling or painful swelling, dysphonia, can't speak, and also there is a severe respiratory distress and also inspiratory stridor. And the patient presentation is very much unique. The position of the patient is like a tripod, leaning forward and having inspiratory strides with along with high fever. So on CXR, on X-ray we see a sign thumb sign on the lateral neck X-ray, and this is most commonly in the vaccinated children and mucosal infection. The next infection, which the next organ which Haemophilus influenza affected is the meninges or EM. So in meningitis, the influenza also causing meningitis in the patient having unvaccinated history. The next thing, it also causes otitis media ear infection, and for the P it causes pneumonia or bronchitis or bronchiolitis. So this is all about the infection of Haemophilus influenza. The most differentiating feature is in the question stem we have to consider, we have to track the word vaccinated or unvaccinated. If the person is vaccinated, then the patient is most mucosal infection are very much common. But if the patient is unvaccinated, there is a mentioning of an unvaccinated history, then go for the meningitis and septic arthritis. I have seen two or more questions regarding meningitis and one question of septic arthritis, but a lot of questions for epiglottitis and the vaccination part for this Haemophilus influenza. The next thing, we give rifampin for the close contacts, and also we gave ceftriaxone for invasive meningitis and septic arthritis infection. And for mucosal infection we give uh, amoxicillin along with clavulinate and clavulinate, because the Haemophilus influenza can make beta lactamase, and this is the treatment of choice for mucosal infection in epiglottitis, otitis media, and pneumonia. And we have known that Haemophilus influenza, Neisseria meningitis, is grown in Thermarton, agar, and also the epiglottitis is influenza is grown on enrichment media having the factor 5 and factor 10 to grow. And there is a very other characteristic feature of Haemophilus influenza, that Haemophilus influenza also grown along with beta hemolytic staph aureus, which give factor 5, and also it is protease, IgA protease, and it is also grown in nasopharyngeal colonization. In the nasopharynx we have all those shine bacteria over there. So this is all about the important things and important question USMLE related data regarding the Haemophilus influenza.